Okay, hi guys. I'm here today with Roddy, who is a pelvic floor physiotherapist from Toronto. And she's not just that, she is the creator of this incredible tool that we're going to talk about today. So we're going to cover perineal massage, when you should do it, how you should do it, why you should do it, and the best ways to go about that. So I want to give Kate a second to introduce herself and tell us a little bit about her background and why she is very qualified to talk about this.
Fantastic. Thanks, everyone. So I have been a physio for about 15 years and pelvic floor physio, which is a lot newer to this industry. I've been practicing now for a couple of years, and about a year ago, I decided to come up with a little bit of an easier way to do perineal massage because 6 years ago, I gave birth to an 11-pound, 5-ounce baby and couldn't reach to do perineal massage, wasn't really comfortable with my husband doing it, and just thought there's got to be an easier way. So if we just had a little bit of extra reach and had a tool or a wand to do that, that it would just make it easier for women. And now I treat and consult and advise pregnant women, which, I mean, this is an amazing medium because women are not really seeing their healthcare providers right now due to the circumstances. So we're going to have to teach this online as best as we can, and we want to really build confidence that you ladies can do it.
Yeah, and I was supposed to come see you myself, and I couldn't because I am currently almost 30 weeks pregnant.
Wow.
So we're getting there. We're getting into that time where I should start with the perineal massage.
Yeah.
And I did not have an 11-pound baby, but with my first pregnancy with my son, I wanted to do perineal massage because I was very well aware of it. I have a background as a doula, so I know all the things, but the actual act of it was very difficult. And my husband was actually not interested in helping me. I tried to get him to help me, and he was like, I feel weird about this. And I was well,
exactly.
It is kind of weird. So you actually reached out to me on Instagram, and I think you had made a comment on one of my photos. And I'm so fascinated by all things to do with pregnancy and childbirth, hence becoming a doula myself.
Right.
But I love the way you phrased the comment. I can't remember exactly what you said, but if you need any help with perineal massage, let us know. So obviously I checked out KR Curve, which is your tool, and I was like, this is amazing. This is such a cool thing that women can have access to because it's not a problem. First off, I'd love to just get into, let's answer the most basic question. What is perineal massage?
Right. Okay. So perineal massage is basically a massage for your pelvic floor, right? So your baby is going to exit out of your vaginal canal, and the tissues obviously need to sort of stretch out to accommodate that head. And right around the area or the exit, right? So the entrance or exit of our vagina, so to speak, those are muscles. And that's the place where, tears or the need for an episiotomy happens. And so if I told you right now to just do the splits, unprepared, unpracticed, right, full splits, we would expect some sort of damage to our inner thighs or some of our hip muscles, right? But over time, just like any yoga practice, over time as you practice your stretching, those tissues accommodate and they get used to the feeling of a stretch. You understand where your limitations are. And so really we're preparing that area for what will happen during birth. So stretching and familiarization is really what perineal massage's goals are for you.
All right. And when should we start perineal massage?
So we recommend right now that there's probably no benefit earlier than 35 weeks. So it's really that last month, and even that first week, you're sort of just getting a sense of what does your tissues feel like, or your pelvic floor, basically, because you've had a weight that continuously has gotten heavier and heavier over those 8 months. And that's pressure on your pelvic floor. And in response, your pelvic floor will tighten up to sort of keep that baby and all of its support mechanisms to hold everything. It still has to maintain that strength. So it's gotten tighter. And then we sort of want to stretch it out and relax it. So
Yeah.
first week is like, what does that feel like? Is it sore? Does it feel tender? Does it feel bruisey? And just get a sense of where you're at to start the first week. And then you progressively get a little bit more stretch, longer holds as we go along.
Okay.
Hmm.
So I don't know if there's a difference here, but is there any benefit to having someone else do it for you versus doing it yourself?
My sports background, we do a lot of knee surgeries, hip surgeries. And what I have always found is that my patients gain more range when they do it themselves because they know exactly how much pressure they're going to put. You have your own internal biofeedback system, right? You know what it feels like the moment you add extra pressure, whereas I have a bit of a delay. So if I start putting pressure for that sort of like stretch, I have to then say, how does this feel? And then you communicate to me, how does this feel? And then it may be too much. And if you go too much, or someone else sort of puts too much pressure, you're going to go into a guarded, protected state. And then it becomes almost a counterintuitive, right?
Okay.
So you're going to be the one pushing. No one else is going to push for you, right?
Right.
So when that push happens, you know how much pressure you're exerting, and then same with your tissue to accommodate. So I prefer when you do it.
Yeah.
I think all patients prefer when they do it.
So this is actually interesting to think of because I didn't really do much massage at all for my first birth. And I guess the act of doing it puts you in touch with those muscles.
Yeah.
It's not just about stretching them out. We're not just, like yanking them open. It's like
Yeah.
actually,
Yeah.
because I tore a little bit. I think I had
Right.
first or second degree tear. I didn't have muscle tearing, but I had stitches.
Right. Okay.
But when I was pushing, like I was pretty out of touch with what was going on down there. I don't know. I wasn't really thinking, oh,
Right.
if I do it harder, something's gonna happen. I was just giving it
Right.
all I had as hard as I could, as long as I
Yeah.
whatever. But is there research? Is there proof to show that this does help with tearing?
Yes. Really, perineal massage and pelvic floor physio hasn't been around long enough, in my opinion, for us to have like the highest level of evidence. So there's definitely research studies out there that do indicate there is a trend, right? We don't have a lot of papers where it's like statistically significant, and that's really what the medical community relies on.
Mhm.
But I mean, it's almost common sense practice, like the yoga sort of example again. The
Yeah,
more you practice your stretching, the more range you do gain over time,
makes sense.
right? So I think some of the studies is that we don't know how diligent were the women, how much pressure did they apply, how long did they really sit there and someone monitored them doing it for 5 or 10 minutes, right, to mimic labor and how long it is.
Mm.
Did they only do one area, not the other? So the thing is we're trying to make it more commonplace. We truly believe that it is going to help prevent tears and episiotomies. And also, if it just helps women get in touch, if you experience a little bit of like discomfort or pain with that stretch, you know what you're capable of and you know what that feels like. And that really decreases fear during labor, right?
That's such a huge thing, right? It's
Yeah,
it has much more of an effect on labor than I even originally gave it credit for. So
right.
it's the fear pain sort of like cycle, right? And I think
Yep.
that is one of the hugest things that interested me about unmedicated childbirth was that like feedback cycle. I'm going to try my best to go into this and not be afraid and just like surrender to the process. And I
Yep.
was able to do, a home birth, which I was very lucky to be able to do.
Amazing.
And I think I was able to manage that because of the fear portion, because I was reading that book, Childbirth Without Fear, which I think was published like way, way back, but
Yeah. Yeah.
I didn't even consider that portion of it, like being more in touch with yourself, understanding your capacity, you know,
Yeah.
really, I think so many women are disconnected from their, you know,
Right.
down their parts.
Well, when we're fearful, and there are studies to show this, but when we fear, when we feel under threat, right? The
Yeah.
first muscles to contract is actually our pelvic floor.
Uh-huh.
And so disconnecting from that fear, right? You can feel it in your shoulders, right? Watching the scary movie, you can feel tension. You feel it in your jaw. These are all normal places that we associate getting tense from fear. But we know from studies that the first place we actually show fear is in our pelvic floor. I mean, of course, like it's when women talk about that feeling in the pit of their stomach, that pit is actually your pelvic floor contracting, right? It's that feeling that you kind of get from the middle all the way up.
So,
And so if we can sort of like figure out how we can breathe through some of this pain and discomfort of those tissues stretching, your body will accommodate to sort of like relax instead of tense up.
right. So it's a lot bigger picture than just stretching some tissues.
For sure, for sure. It's really the whole body going, how do we embrace what is happening? And yes, we can stretch tissues, but we can familiarize ourselves with what does labor feel like? Because no one really
Exactly.
knows what that feels like until you're in it, but we can start to mimic some of what it would feel like.
Pressure and stuff like that. Yeah.
Yeah, for sure.
Obviously not going all in to like put ourselves through pain. That's not the point.
No, no,
Right.
no, exactly. And that's why everything is more of a graduated approach. The pressure, the sort of stretch that you're going to be applying is always on sort of an incline and to a point. And then you can hold that point, and then can you practice breathing through that point such that whatever you're feeling diminishes a little bit, and then do we take it a step further, right?
Mm-hmm. How do we do it?
Okay. All right. This is Sally Silicone. Okay. She's my brand new vagina vulva model. Okay. And basically, so here we have the vulva, which is our external part. Okay. So that includes our labias, which is the lips. Okay. Our clitoris, our clitoral hood. Okay. Then we have the entrance of our vagina. Okay. We're going to come in a little closer if that's okay.
Get in there.
And then basically, so if we were to, for angles, let's say we're not using my tool, we just want to try with our hands, okay? The easiest angle for you to do, okay, is you're going to maybe prop yourself up in bed. The other place I really like doing this is in the shower, because you can sit in your tub if you have more of a tub setup versus like normal walk-in shower. And then you can just let your legs flop out to the sides of the tub, which is pretty much what you would be doing in labor if on your back, which we're trying not to recommend, but if that's what maybe how you're sitting. And then basically the easiest thing is to hook your thumb in, okay? You hook your thumb into the base of the vagina, and then you want to picture your vagina like it's a clock, okay? So right at the bottom is 6 o'clock. So that's really the easiest part to stretch because it's the most pliable area.
Mm-hmm.
So you would basically apply pressure straight down, okay? So straight down, maybe hold that for 20 seconds. And then you would come out to maybe 5 o'clock and you'd stretch on that area for 20 seconds. And then 7 o'clock, okay? So those are the 3 spots that I would start with. And then basically the only place you don't want to come straight up is 12 o'clock, because that's where our urethra, or where we pee from, that's where that is. And you're not going to press on that. As soon as you do press on that, you're going to realize that's not a good feeling. Okay. So anywhere from about 2 o'clock, okay, all the way down, we can put pressure on that vaginal sort of opening, or what we call the introitus, which just means the entrance.
Okay.
Right.
And so what do we need for this massage? Like, do we need lube?
So sometimes
Milk?
it all depends, right? Because you're just hooking into the entrance. And the other thing to remember is lube is really to prevent friction. We're not frictioning in and out. We're just putting pressure down. So you may find that it might be more comfortable. And in that case, you can use whatever normal lube that you would use during sort of like any other activity, or you can use a coconut oil, which is nice. An oil-based lube is going to be a little bit more longer lasting. The other thing is you don't want it too lubed up either, because you don't want to slip, right? You want a good hold to apply pressure, but without sort of like feeling like you're going to slip every time you apply more pressure. Right? So you can try with or without. You're going to kind of feel what feels good for you.
Are there any oils that you recommend not using?
So this would be, it's a tricky question, because I would just stick to, I think olive oil is fine. And I believe I know coconut oil is fine. The other ones I would maybe stay away from. There's just not enough research to say what your pH and what you may become irritated to, what else they add to it. So try and just pick the most sort of like the virgin coconut oil, the virgin olive oil, the really pure ones.
Okay. All right. That's good info. And then how often should we be doing this?
So the first week, so let's say you're 35 weeks, right? I would say if you were to do this every second or third day as a start, right? This is really where we're just familiarizing, because what you might find is that because this is new, it's like going and doing something new for the first time, right? If you go to yoga for the first time, you may actually feel a little bit sore and worked the next day. So we're going to give our body a day off. But then we're trying to increase frequency. So then maybe if you're going every every third day, you go to every second day. And once a day is reasonable in those first sort of like couple of weeks. As you're coming down to that final week, you may want to try and do it more often. Nothing is going to hurt you so long as you are listening to your body, respecting your body's limits for this, and sort of increasing gradually as you go. If you sort of do week one, kind of like skip a whole bunch of weeks, and then you're like, oh no, I'm in my 39th week, I would not suggest sort of going to town on this, because that's when, again, your body will feel like you're attacking it, and it will negatively protect and guard, which is what we don't want. So it really is a gradual approach over like 3 or 4 weeks.
Okay. All right. And so I can't remember if you've already covered this. So the first session it's going to be shorter, but then we're working up. How long on average would you say, like, for how long should we spend on our first session versus like in the second week, third week?
Right. So I would start with like 3 or 4 minutes in your first week to just really like see how it feels. You're picking 3 different spots, maybe 4 different spots, applying pressure for 20 seconds each. And then maybe you do that a second or third time. So that's how you kind of get to your 3 or 4 minutes. And then as you're adding time, you might be doing 30-second holds, 45-second holds. If you need a timer, I mean, God knows when we go into labor, we have a timer to time everything in between. So you can pull your stopwatch out, or the timer on your phone, and be doing this. And then, I mean, working up to 15 minutes is reasonable, right? Because every push, the push only lasts for like what? You're pushing for that 10 seconds. It's amazing how pregnancy really like escapes your brain when you're out of it. But I remember being told that I had to push, and someone counted me down from 10 seconds.
Yeah.
Right? So that's really the stretch on those tissues. So, a good hard stretch for 10 seconds, you might build intensity, but then you're doing it for 15 minutes, right?
Okay, that makes total sense. And so now, how much different is it to go ahead and start using a tool like this?
The Kegel release curve. So basically, there are two ends to the Kegel release curve, okay? So we have our smaller end, which is what you're gonna start with, okay? So for pregnant women, we're gonna still start with our smaller end, okay? Just like the thumb, you would hook the bottom in, okay? Right to the base, and then you're just using a little bit of leverage, okay? You're trying to put downward pressure, and that's why the angles on this are really helpful, because so much easier on our wrist and hand. When you receive this in the mail, the first thing everyone says is it's heavy, right? And that seems a little bit ominous at first, but it actually provides such easier leverage for you to then work that tissue, okay? And then you can just change the angle a little bit and then put pressure out here, right?
Yeah.
So
Because you're reaching
basically,
a big giant belly, so
exactly.
it's really helpful to have that.
Exactly. Like I was as big as a house, of course, with an 11-pound baby. Like I could barely reach to wipe, if we're going to be honest. So, like trying to get the angles, my thumb, like my arms weren't long enough. So this is helpful. The other thing with this is it's casted out of surgical grade stainless steel, which means you're going to sterilize it, okay, which I think is like a nice comfort to pregnant women. So sterilize this when you receive it, and that's just boiling it in hot water for like 8 to 10 minutes. And then it holds the heat really nicely. So again, if we go back to the bathtub example, just warm this under the hot water of the shower, and then you can sort of insert it, and that even warming effect, maybe you just, you know, slip it in and let it sit for a second, let it warm, and then provide some pressure.
That's why we stretch after we work out, right? Because warm muscles respond better.
Exactly. So, and then over the time, we do have the bigger end, which again, I've had a couple people be like, so that end goes in? And I'm like, ladies, baby head is like this. So we need to at least,
It's not that big.
I know, but a couple people have been like, wow, that side. And I'm like, well, the baby's head is about twice or three times that size. So this is just a little bit bigger to accommodate and get a little bit more pressure. But again, like 38, 39 weeks is when you would try and be aiming for this. Some women can go at that right away, whatever you're comfortable with, whatever feels, you know, okay for you.
Okay. Okay. Uh, this thing is great. I don't know. It comes in this beautiful little carrying case, like so nicely. I was so impressed when I received it. I haven't used it
Amazing.
yet, but I'm very
You're
excited.
getting there. You are getting there.
And
Yeah. So,
yeah, so should you use a lube with that one?
so some people say yes. I mean, we always have our own. I mean, during pregnancy, a lot of women will make the comment that they don't have a lot of lubrication postpartum, right? And that's another discussion when you get there, Millie, is how do we use this postpartum, right? There is reasons for using it after. We will get to that probably on another call. But during pregnancy, women don't normally, like, you probably have enough of your own self lubrication. Again, this is like mirror polished, so it's pretty slick, it's pretty smooth. So you may find that you need a lubricant, you may not. You'll try it out, you'll know immediately what you need. Okay.
Okay. Yeah, so I do want to just quickly touch on this, because if somebody was interested in getting their hands on one of these things,
Yeah,
I'm sure that they would love to know that it would be useful to them beyond, the 4 or 5 weeks that they'd be using it at the end of pregnancy. So just
absolutely.
very quickly,
Hmm.
give us like a quick summary of why you would find it useful later on.
Perfect. So if this is going to hold heat, it also holds cold, right? So after you've been cleared by your doctor at the 6-week mark, or your birth provider, and you're sort of in the clear, then you basically are allowed to start having sex. So you're not supposed to insert anything in those 6 weeks, because we treat that healing uterus as almost an open wound, and we don't want to introduce bacteria in case of infection. But after that 6-week mark, I find that women are still actually swollen in their pelvic floor muscles, which is no different than a knee being swollen 6 weeks after surgery. We definitely still see swelling. So you can cool this in cold water or in the fridge and then insert, and it acts as an internal cold pack, which is super soothing, right? And then the other reason why you would start to use this at 6 weeks is that there was a study done in 2015 that reports that 86% of women report having painful sex on that first encounter after giving birth. And it's because those pelvic floor muscles basically went through hell and back, and then they need to heal. And how most tissue heals is it guards, right? It gets tighter to
Yeah.
protect.
Yeah.
And then it's going to protect even against sex, so to speak. And that's why it's painful. So you can use this again. It's like doing perineal massage to prepare for sex. And most women don't do that. We just keep hoping that like the next time will be better and the next time will be better. But that doesn't always work. And that study showed that almost 30% of women go on to having painful sex for 6 months after. That's not something we want to sign up for, right?
No, right.
So a little bit of preparation after.
If you continue to have painful sex, it could be a symptom of tight pelvic floor muscles, correct?
Absolutely. And then the first time's painful. And then what does pain do? It causes fear. So then fear works itself into the second like encounter, and you kind of think it's going to be painful. So what does your body do if it thinks it's going to be painful? It guards. And then we have that increased friction and tightening, which that's why we're getting pain.
Okay.
Potentially. You want to always talk it through with your healthcare provider, but
Sure.
yes.
So I saw a pelvic floor physio, I think 6 weeks after I had my son. And
Right.
then I can't remember if I went back for a second visit. I think maybe I went for one more visit, but I didn't go during pregnancy. Is there a benefit to seeing a pelvic floor physiotherapist during pregnancy?
There is, and the reason why we say that is we teach you all of the perineal massage. We talk about birth positions. We talk about, are you having pain anywhere in your body? A lot of women will complain about like sacroiliac joint pains or SI joint pain.
Yeah.
So we sort of work through that, but also it's very much, I'll go back to like a sports analogy. If you were going to have a knee replacement or a knee surgery, we want to strengthen up the muscles surrounding that joint before the trauma happens, right? Because it's easier to teach someone how to use their joint before trauma than after, because trauma really inhibits a lot of muscles.
Mm-hmm.
So if we can teach you appropriately how to use your pelvic floor, which honestly, most women do not know how to do a pelvic floor contraction or what we call a Kegel, right? We all think we're doing it. But even myself, lo and behold, like I absolutely could use some improvement, even though I think I'm doing it. I remember I got graded. Someone was like, we graded out of 5, right? 5 being like, feels like you're going to clamp my fingers. Like they're like, yeah, you're about a 3. I was like, really?
Huh.
And I really felt like I was giving her. And no, they're like, yeah, it's about a 3. And then like, you don't really have much endurance. I was like, good to know.
He's
So
ego.
yeah, I know. I always say no matter how much knowledge I have in my brain, it doesn't translate to my body moving in the way I want it to.
No, I watch my, TikTok choreographers, and then I'm like, in my head, I can move like that, and then I try to do the dance myself. I'm like, it's never gonna happen.
No, yeah. So very similar. We want to see if we can train you because if you can do a pelvic floor contraction really well and we can get that training ahead of time, your mind body connection will kick in faster because it's like riding a bike. You've done it before, and some of those like little muscle circuitries, they'll kick in. They'll be faster for you after birth.
Okay, that's good to know. All right, this will be one topic that we've covered, and I think we're going to come back and do a second episode or
for sure,
whatever of this conversation fully focusing a lot more on like pelvic floor health for
Yeah,
postpartum and stuff like that. It's just too much for one video, but this has been
for
really
sure.
informative. I really loved this conversation. Thank
Good.
you for taking the time to come and chat with us about this, because like you said at the beginning, it's a sort of more of a new thing that people are becoming aware of. And I think it's super helpful because, you know, generations past, even just 5, 10 plus years ago, everybody just had
Right,
to suffer through everything, you know?
right, for sure.
We
Yeah,
deserve to have this knowledge because it's empowering. Um,
yeah.
and so, what I'd love to have you do now is let everybody know where they can find you, where
Okay,
they can find the KR curve, and if they wanted to get in touch with you, for whatever reason. We're in
okay.
the middle of the corona pandemic right now, so
Exactly.
nobody's seeing anyone in person. But are you offering phone consults? Like, where can we find you? What's happening?
Yeah, perfect. So, okay, so let's start with the Kegel release. Okay, you can find this product on our website. If you just type in KR Curve, CURVE.com, it'll take you right to our website, KegelReleaseCurve.com. And on there, we are in the process right now. It will be up within the next week. We are offering online consults for a small fee. However, that fee will be waived if you buy the product, okay? And that way we can have a one-on-one, just like you and I just did, Millie, on how to use this. We usually will say, wait till the product is mailed and then you have it in hand and then we can go through it.
Mm,
You can also ask me any questions at that time about your particular circumstances and we'll try and answer those. And you can email me from that website. There's a contact within that. And then I can be found on Instagram at Kegel Release Curve is the company website, or you can find me at Kate Roddy, RODDY _ 6IX Physio.
the number 6IX. So
Yeah,
I'm
Physio.
going to link all this stuff in the description just so people
Perfect.
have an easy access to it. Um,
Perfect.
but I'm so excited for this product. I'm so excited that you're from Toronto and you're doing cool things.
Canadian made.
Yes. And again, thank everybody for watching. And if you enjoyed this video, please share it with a friend who might be expecting. And make sure you subscribe over here and hit the bell, turn on notifications so that you always know when a new video is coming out. Give us a thumbs up on this one and have a great rest of your day.
Thanks.